NABN, New Africa Broadcasting Network.
Dr. Terrance Lee Baker, Medical Director of Soleil Medical Center, Soleil Laser Medical Center, Baltimore, Maryland. Good afternoon, sir. How will you introduce this center to your viewers? This is an international community.
Yeah. Soleil Laser Center, Soleil Medical Center was started back in around 2000, the year 2000. It was a general family practice office that was using cutting-edge technology in ways that had never been seen before. That is, applying laser light and LED light to treat patients who had medical conditions for which traditional medicine was not complete. That is, traditional medicine would not alone heal the patient. And so we began treating wounds, skin wounds. We began treating medical conditions such as shingles, herpes zoster. Here in the States, we call it shingles, which is the chickenpox virus that comes back in adults and causes very painful breakouts. We began treating gangrene. We began treating skin wounds that were caused by accidents, caused by surgery, caused by trauma, caused by war, caused by pressure ulcers, caused by diabetes. We began to treat wounds that no one else could heal using the light. And so that's how we started Soleil Medical Center, Soleil Laser Center, was to begin applying the light to medical conditions that we knew we could heal, and yet other types of medicine, medications, surgeries, pills, potions, lotions, would not heal the patient.
Can you give us the background of your medical training?
Yes. Background in medical training is I started here in Baltimore at the Johns Hopkins University. Received my bachelor's degree in natural science. I stayed on at Johns Hopkins and got a master's degree in developmental disabilities. During that time, I completed putting together funding for medical school at George Washington School of Medicine in Washington, D.C. I then was blessed in 1980 to be accepted for advanced training in family medicine and women's health, geriatrics, and emergency medicine. Began to have advanced training at the Medical College of Virginia. I currently am board certified in practice on a daily basis in the areas of family medicine, geriatrics, that is the treatment of patients over the age of 50, emergency medicine, and forensic medicine.
You tell us a brief about where you get this kind of drive for. Is it just because you have that humanitarian inside you and the challenge of modern day medicine?
What I was looking for was answers to treat medical conditions that I was seeing every day in the hospital, the office, the emergency room, painful conditions, wounds that wouldn't heal. I was looking for answers when I learned about photobiomodulation therapy that at the time was known as low-level light therapy, LLLT. And I began, as the more I learned, the more I read, the more I studied about photobiomodulation therapy, the more I realized that this new science offered hope for patients who had no hope. And then I began to study with Dr. Fred Kahn, who is a professor in Toronto, Canada. Began to study with Fred Kahn. He is a vascular surgeon who was using this new science to treat patients who had artery problems. And then I began to study with Professor Chichuka, going to lectures, seminars, reading so many of his papers that were being published about the use of red light, near infrared light, and most recently blue light. And so between Dr. Fred Kahn and Professor Chichuka, I came to realize that this new science was something I wanted to do with my patients.
You're talking about Professor Chukwuemeka Emeka, who is world-renowned in laser therapy. You're talking about Dr. Jeff Kahn from Toronto, Canada. And I do see in your resume that you are the current president of the North American Association of Biomodulation Therapy. Highly esteemed, highly regarded, and highly deserved. Can you tell us a little bit about this association and what you have brought into this association?
The North American Association of Photobiomodulation was started approximately 20 years ago by Professor Chichuka, who realized that there needed to be an organization that would teach this new science to doctors like myself, and physical therapists, and athletic trainers, chiropractors, occupational medicine practitioners, and nurses. And that this new science needed to be taught. That is, that the only way we could change patients' lives was for doctors and nurses and therapists around the world to know. So that's why NAALT, N-A-A-L-T, the North American Association of Photobiomodulation Therapy, was started. The role has continued to be education. We had a conference in Detroit where we spent 4 days talking about applying light to patients who have opioid addiction for the purposes of relieving their pain using light instead of drugs, and over time getting them off their medications, off their drugs, and using the laser light.
So you're saying that laser therapy, LEDs, and near infrared, and short wavelength ultraviolet rays and all that can be a substitute for this.
That is correct.
So how effective have they been? Which will go back to your patients.
When applied early in the care of patients, for example, in the first post-operative day, when laser light is applied to surgical sites and to injury sites, the need of the patient for pain medication, opioid pain medication, is significantly reduced. In fact, studies have shown that as little as 15 to 25% of patients will require any opioid medication at all if you combine that with applying photobiomodulation, that is laser light treatment, early in their recovery. The sooner the better. The second question is that patients who are already on opioids, that is, patients are already taking narcotics like oxycodone, OxyContin, Percocet, Tramadol, medications like that, what you have to do is bring them in and start them on laser light treatment, and then over time,
you can
titrate them down and taper them off, reduce the medication that they're using. That's correct.
You've been practicing medicine for 30 years, and this new area which you added to your practice of medicine, it's not that you stopped the other area of medicine. Has there been a change of attitude towards your clinic particularly, and your personality particularly, among colleagues and among the pharmaceuticals?
Now, it turns out, because in our practice we have what I call a balanced practice. That is that we will offer a care plan, a plan of action for each patient that's unique for that patient. And typically for many patients that will be a combination of medications, therapy, and photobiomodulation. It'd be a combination, if you will, of those different ingredients, if you will, in order to make the patient well again.
Isn't that the definition of good health by the World Health Organization?
Yes, I believe it is. I believe that each patient having a care plan and meeting the needs of the patients using all modalities, surgical modalities when necessary, medications when the condition, there are certain medications that require the treatment of certain medical conditions requires medication. For example, if you're an asthmatic, you probably need an inhaler, and from time to time you'll need some steroids and some antibiotics. That's an example of a condition.
You might need physical activity that is going to improve your lung volumes.
That's correct.
Okay, not just packing the medication in, but actually transforming it to physical capacity improvement and thereafter functional improvement. And that is when we have the real benefit of all the intervention.
That's correct. And I'm going to show you later on a laser that we're using from Denmark, manufactured by Paramedic, the manufacturer, where we can even take an asthmatic and apply light to their chest and improve the condition of their lungs, which makes them less likely to wheeze.
We'll be right back. Okay. Can you tell us your patient generally in sports medicine, in geriatric medicine, am I right? In women medicine?
Our patients actually start with mothers that are pregnant and young babies that are just born, all the way through to, I think our oldest patient is 112. And so we really see men, women, children, infants, of all ages, from pregnancy till the grave, to near death.
But specific to this biomodulation, how has it impacted some of those patients? If you can give us examples.
Yes. Well, you have to understand the common denominator, the common factor between all these patients from young to 112 is cells. That is, cell tissue absorbs light. It's susceptible. It is. It receives light, turns that light into energy, and then the energy is used to heal the cell. And so it doesn't matter if you're a child with a medical condition, the light will help you to heal the condition. It doesn't matter if you're 90 years old, it will help you to heal the condition. Now, a couple specific examples. One is wounds, skin rashes and skin wounds. Skin rashes and skin wounds are often mysterious and not very well understood by doctors. And we really don't have a good approach. We use surgery, we use lotions and potions, we debride them, we use electrical stimulation, we use hyperbaric oxygen. We use a lot of different modalities, but at the end of the day, there's certain wounds that are hard to heal. Let me give you two classic examples. A 65-year-old woman in the nursing home develops a pressure ulcer. The pressure ulcer is on her lower back and her buttocks, her butt. The wound goes all the way down to the muscle. The surgeons cut it away, they clean it up, they scrub it, they put on debriding agents, they correct her diet with extra protein and extra water, but it won't heal. But when you apply red wavelength light, somewhere in the range of 640 to 670 red light, nanometers of red light, and you apply near infrared light, something around 810, 808, 810, something up to 840, even 870 nanometers. What happens is when you do that and you apply that 2 or 3 times a week, you're supplying an external source of energy to the cells that remain so that the cells can divide and replicate and heal themselves. And what happens is just after 2 or 3 days, you start to see the wounds start to close.
Okay. Dr. Baker, I need to give me specific examples of how biomodulation have enhanced the recovery or the outcome of some of your patients that you have seen.
Yes.
You've said quite a bit of the biology and the biochemistry and the sciences behind it all.
Yes.
But let's see this patient. I want my colleagues who are medical doctors, who are medical practitioners in other areas of medicine, to actually see how this has worked.
Yes. Well, first we had the 65-year-old female with a stage 4 decubitus ulcer on her backside. 18 treatments of using red light and near infrared light 2 or 3 times a week. She heals her wound. We have healed hundreds, probably thousands of decubitus ulcers over the years.
That's incredible.
Next is gangrene. We have a growing number, over 12 patients who come to us with extremity, usually ankle and foot gangrene from poor circulation. Again, these patients, somewhere between 18 and 25 treatments of red and near infrared light spread over a 6 to 8 month period, are completely regained their ankle and their foot. Another example of a skin condition is herpes zoster and post-herpetic neuralgia. That is the very severe pain that follows an infection by shingles. We had a gentleman flew here from Australia. He heard about us on the internet. He flew into BWI. He stayed with us for 3 or 4 weeks. We treated him 2 or 3 times a week until he was healed. 12, 13 treatments later, he is healed. When he came to us, he could only wear half a shirt. True story. When he walked in to see us, he had his left shirt on, nothing on, naked right side.
Because of the paresthesia? Because
of the severe pain, the neuropathy, the severe pain, he couldn't even allow a shirt to touch him because of how painful he was. Using our lasers, and we may have a chance to look at the equipment we actually used, is that we were able to heal that over a 12 to 15 session treatment, and he went home fully dressed. Next would be bone, muscle, and joint problems, back pain, hips, knees, ankles, shoulders, wrist, different types of arthritis, osteoarthritis, rheumatoid arthritis.
That's 60% of medical practice.
Yes. Your arthritis type pains, when either with or without medical management, respond very well to applying photobiomodulation treatment. Backs, knees, hips, very helpful. Also, if someone does have surgery for a bad knee or a bad hip, if you apply photobiomodulation as part of their rehabilitation, they recover faster. Less swelling, less pain, less likely to get infected.
Yeah, you knocked on something very important now. So, post-injury, post-surgery, you can apply this for meniscal injuries.
Yes.
And they're going to improve and have a better recovery. Actually, going to have healing and recovery.
Yes. We have a lot of athletes that come to us with injuries that we facilitate recovery of the injury, or we prevent injuries. We have pitchers that come to us. We apply light therapy to the arm they use to pitch in order to prevent injuries while pitching. And if they do hurt themselves while pitching, we use photobiomodulation to accelerate healing of their athletic injury.
Your surgeon colleagues have also referred patients to you to improve the outcome of healing post-surgery.
Yes, we have patients from the wound care center that are being sent to us to assist the surgeons that are seeing them in the wound care center to assist healing. We have surgeons who do artery surgery. That is, patients have poor circulation in the arteries of their legs. They get surgery, fixes the artery, but then they will send the patients to us to fix the capillaries. That is, the small vessels that carry the blood from the arteries out into the leg, out into the ankle and the foot.
Okay. Viewers at home, this is NABN TV. We have the privilege to be talking to a highly successful medical practitioner. Is also currently the president, National North American Association of Photomodulation Therapy.
Yes.
Thank you so very much, and it's been a pleasure talking with you.
NABN, New Africa Broadcasting Network.